Have you ever experienced a sudden pain around your navel, and then sometimes it moves to the lower right part of your abdomen? This could be just not an ordinary stomach ache. It could be an appendicitis. In this video, I'm going to tell you all you need to know appendicitis in the most simplest form possible. So stay with me to the end because this information can save a life one day. So let's get started. What is appendicitis? Before we move over to talking about appendicitis, we need to know what an appendix is all about. What is an appendix? An appendix is a narrow blind end tube attached to the large intestine. You can actually say that it is a finger-like pouch attached to the first part of the large intestine, and it is actually located in the junction where the large intestine meets with the small intestine. So initially it was once thought that this appendix has no function, but these days research suggests it contributes to the immune system, and it also maintains the healthy gut bacteria. Now let's talk about the functions of this appendix. Here we have, just like I've said before, that it maintains the healthy gut bacteria. These are the normal bacteria that lives in the digestive tracts, especially the large intestine. They keep the digestive system healthy. We also have some functions such as contributing to the immune system, and also they contribute lymphoid tissues that helps to fight infection. So let's move forward to talking about what an appendicitis is. An appendicitis is simply the inflammation of the appendix, and this is one of the most common cause of an emergency abdominal surgery. Now, what are the causes of appendix? We have several causes such as hardened stool. We have something like swollen lymphoid tissues after an infections. We have intestinal parasites. We have foreign bodies in rare cases, and tumors in also rare cases. Now, what are the risk factors of this condition? We have risk factors ages from 10 to 30. So if you are between the age of 10 to 30 years of age, just know that you are so prone to having this condition. We have also conditions like the family history. We also have something such as low fiber diet. That means food that are low in fiber. Now let's talk about the signs and symptoms of this condition. Here we have the early symptoms, we have the later symptoms. So talking about the early symptoms, this is where we have initially there is pain around the umbilicus. Then there is we can actually have something like loss of appetite, nausea, vomiting. Then talking about the later symptoms, this is where we have this pain can actually move down to the lower abdominal right of the abdomen. You have something tenderness at the lower side of the abdomen. You can equally have fever, and we have the classic signs of this condition. Here we have the McBonnell's point tenderness. This is where there is pain when pressing a particular point in the abdomen. We also have something called the rebound tenderness. This is when the pain gets worse. Immediately the pressure is being released. Then we also have something called the guiding. The guiding, this is where the abdominal wall gets tightened in order to protect the inflamed part. So naturally, in a simple term, this condition occurs when there is maybe the appendix itself gets blocked, maybe by its hardened stool or foreign body or whatever. Then because of its blockage, it will like make room for a multiplications of bacteria, and then if these bacteria are not being treated on time, it can actually result to the inflammation of this appendix, which can in severe cases rupture and then death if care is not taken. Now let's move over to the diagnosis of this condition. How is it being diagnosed? You can actually diagnose appendicitis through an ultrasound scan, usually for pregnant women and for children. You have CT scans for adults. You have urinalysis in order to rule out that it is not a urinary problem. You have something like the physical examination and the medical history. Now let's talk about the complications of this condition. If left untreated, you might have something like the rupture of the appendix. You might have something like the peritonitis. This is the inflammation of the abdominal lining. You might also have something called sepsis. This is severe infection, severe body infection, and then you might also have fever and so on and so forth. Now let's talk about the nursing care given to a patient before and after surgery. Before surgery, you'll place this patient on new pre-oral. You monitor vitals. You start the IV fluid as prescribed. You give antibiotics, give pain relief, and you should also ensure that you don't apply heat on the abdomen in order to reduce, because this actually increases the risk of rupture. Then after surgery, you have something like you care for this patient through you have to like give pain relief, monitor for early ambulations, check for signs of infection, monitor vitals closely, give IV fluid, and so on and so forth. Also, you have something like you also give antibiotics. This is where the antibiotics is given before and after the surgery, especially if there is a case of a ruptured appendix. You also can give IV fluid and so on and so forth. Now let's talk about the treatment for this condition. The standard treatment for this condition is surgery, and the surgery for this is known as appendicectomy. Now we have the two types of surgery, where we have the open surgery and then the laparoscopic surgery. Let's not go into details discussing this. Now let's move on to the prevention of this. Generally there is no guaranteed prevention for appendicitis, but there are some guidelines which can actually help to reduce the risk, and this include taking food rich in vegetables, rich in fibers, and then rich in fruits. Then let's move on to the misinformation of this condition. These are the misconceptions. Here we have people say that the pain of this appendix actually starts from the lower right part of the abdomen, and that is not true. This pain usually starts around your navel, and then others say that antibiotics alone is enough to treat appendicitis, but that is not always true. The standard treatment for this case is appendicitis. Now, in conclusion, I will say that an appendix is a small organ attached to the first part of the large intestine, which is the cacum, and the inflammation of this appendix is known as appendicitis, and this is actually an emergency condition that should never be ignored. Early recognition of the symptoms and prompt treatment can actually prevent a life-threatening condition. So if you or you know a person having such pain, please, I advise you seek for immediate medical attention. And at this juncture, I have come to the end of this video. Thanks for watching, and if you find this video helpful, don't forget to like, share, and comment. Also, don't forget to turn on the notification button for more detailed reliable health content. Bye for now, and see you again.